I want to sincerely thank you for being my patient or listening to my information and attempting to help others as a professional. This particular video is on blood oxygen level test, on the blood oxygen level test. This is kind of an important, very important thing, which we very often don't associate with TMD, and it has to do with breathing and sleep and other issues. And just to review, the Atlanta TMD Institute has three purposes: to educate dental and medical professionals in TMD, to develop knowledge of TMD or temporomandibular disorders, which is really lacking, and to successfully treat patients suffering with TMD. And whatever your purpose is, this is absolutely a very, very important topic that involves several videos. And once you come to see the importance of breathing to the body, it just is overwhelming how many problems can occur when people don't breathe correctly. And this is particularly interested in dentistry right now because of obstructive sleep apnea. But there are many conditions where the inability to breathe is not as bad that you choke to death, but is really likewise causing major problems in a person's body. This video is presented by the Atlanta TMD Institute. The purpose of the Institute is to educate dental and medical professionals in TMD. Prior to COVID, we were lecturing a good bit. We're going to try to continue that as things get better and better. We want to develop knowledge of temporomandibular disorders in general with books, and also to successfully treat patients suffering with TMD. And we're a tertiary center, meaning that patients can come directly. Patients can be referred by physicians, dentists, physical therapists, and also by other specialists if there are major problems. We are here to think things out and analyze and be successful. The title of this lecture is The Calorie Lie, and we're getting involved in diet because diet has a great deal to do with TMD, and excessive fat also has a great deal to do with TMD and sleep disorders. So we're going to bite right into the calorie lie and try to get you, first of all, to learn things in a new way, think completely differently. And it's going to be difficult because we're going to give you information in the video. You're going to listen to it. It's going to make a lot of sense. But I think 2-3 days later, even, it's going to be hard to break out of your old thoughts, things that you were taught. And because this is totally revolutionary, it's not revolutionary from the point of view of, my God, the information was not there previously. It was there. It's just people didn't put it together. So we're putting things together for you so that you can think about decreasing your inflammation and your weight and the toxic fat load that so many TMD patients have. So just to start, because we're getting into specific information, we start with a medical disclaimer. All content in this video and all information, including but not limited to text, graphics, images, and other material contained in this video are for informational purposes only. Different patients respond differently to different things, so that the information presented is not intended to be a substitute for professional medical advice and should not be relied on as health or specific personal advice for you. Dr. Mark Allen Podolsky is not a physician and not a dietitian. He commonly refers patients to these other healthcare professionals when patients wish to be supervised. Always seek the guidance of your physician or other qualified healthcare professional with any questions you have regarding your health or medical condition. Never disregard the advice of a medical professional or delay in seeking medical advice because of something you've watched in this video. If you think you may have a medical emergency, call your physician, go to the nearest hospital emergency department, or call the emergency services immediately. If you choose to rely on any information presented in this video, you do so solely at your own risk. Dr. Podolsky does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned in this video. Reliance on any information appearing in this video is solely at your own risk. So often people will call and they'll want advice, or they'll email and they want advice. And we got to be careful, because over my 40 years of practice, I have diagnosed several cancers, several brain tumors, other things. And when you call me, it could be something really terrible, but you're thinking it's a TMD problem. So I have to be very careful when I start talking about dietary things and other things that typically help TMD patients. I have not diagnosed you as a TMD patient. And if you come in, which you're welcome to do, that's a different story. But again, I have to say, I'm not a physician, so I cannot make a medical diagnosis technically. I can get a preliminary diagnosis and send it to a physician for confirmation. Absolutely, we do this every single day. I've diagnosed diabetes and I don't know how many people, thyroid problems, and I don't know how many people, but it was always confirmed later and treated by a physician where it's supposed to be treated. So again, thank you for looking at the video. I'm just so happy that you're watching it, and hopefully this video will change your life. So patients with temporomandibular disorders often have generalized inflammation throughout their entire bodies. It's not just the jaw joints. It could be the elbows, the knees, the back joints. They generally have a lot of inflammation. And this is why, everybody says, well, this person has a TMD problem, this other person has the same TMD problem, but one person has generalized inflammation, the other doesn't. The one with the generalized inflammation has problems. So this inflammation, along with the really nice side effects of losing excessive belly fat, can often be eliminated with the correct healthy diet for their situation. And this is what this video is starting, an introduction really to dietary changes that need to be made in TMD patients. And not all TMD patients have to eliminate excessive fat, because they may not be fat, but I'm going to say 75%, or maybe 60 to 75%, my estimate, of patients with TMD have excessive fat in their body, and fat is toxic, and we need to eliminate it. In order to eliminate, we first got to get the way you think to change, because a lot of the diets that are out there right now are just screwed. You hear history after history after history of someone starting a diet and then losing weight and then gaining it all back later, and worse. So you first have to understand how the body works in order to properly plan and execute a very effective diet to eliminate temporomandibular pain and multiple other problems. Many temporomandibular joint or TMD patients have central obesity. It means obesity in their tummies. They have a big belly. And you can tell this when they walk in the door, and it is a common sign. Sign is something we see, like you see a stop sign tells you to stop. It doesn't say anything, but you can see it. So when a patient walks in with a big belly, we know that there's something going on. And generally they have a great deal of inflammation, and this causes joint irritation, not just in the temporomandibular joints, but all throughout the entire body. Also inflammation in the throat, right? Swelling of the tongue. All this stuff is bad. And the first thing we want to do is address this problem, or one of the first things we want to do is address this problem. And we have to first encounter and get rid of this calorie lie. The calorie lie, what is it? First of all, there is no need to count calories to lose your big belly. Oh my Lord, I'm telling you something that you are not going to believe, because you have been so brainwashed, deeply brainwashed, that when I say this, you don't have to count calories. You're like, that's crazy. You're crazy. And you immediately reject what I'm saying because you think it's crazy. Of course you have to count calories. Calories add up to amount of energy, like fuel in your car. But no, it's not. The human body, the way God designed our body, is not in that manner. And a lot of physicians and healthcare people just don't understand this. And we're going to disprove this false lie, the calorie lie, in this video. So here are the facts. Eating lots and lots of calories does not always cause weight gain. Yes, you heard me right. Eating lots and lots of calories does not always cause weight gain. Everyone knows someone who can eat like a horse, eat all of the turkey and all of the pie at the Thanksgiving dinner and never gain weight. Like, what's that about? Is that fair? Well, it has to do with how the human body works. And if we can harness the secret that that person's body has who doesn't gain weight, then we're going to be able to change our body and decrease our inflammation, improve our sleep, and just feel great all the time. People who count calories, and a lot, unfortunately, scientific people, they burn the food and they say there's so much energy in this food. There's so many calories if you eat this food. But that makes the assumption. They believe that that food gets all burnt up in your body. Well, the body doesn't have to do that. Now, you have choices in life. That's obvious, right? Maybe you're going to marry the guy or girl you're dating, or maybe you're not. Maybe you're going to go to bed at 10 or maybe at 11. You have choices about everything in life. Personally, that should make sense to you. You choose things. Well, guess what? Your body also has choices. The body can keep the calories it eats or throw the calories away if it wants. If you have a big belly, you want your body to say, gee, I'm going to throw these calories away. I'm going to throw the calories away that I eat. I'm going to throw the calories I eat away, right? So what you really want to do is teach the body to throw away calories instead of use them. And yes, absolutely, you can do that in most cases. So here's the thing, right? We have to understand how insulin works because if we understand it, we can possibly control it, right? So to understand how you can encourage your body to throw away calories that you're eating, let's study how a patient looks and what happens to a patient when a patient has no insulin. This patient cannot make insulin. This is a hormone in the body that goes throughout the body and controls sugar. This patient cannot make insulin. In the past, patients who could not make insulin would quickly waste away and die. They'd lose so much weight that they would basically starve. Even though they're eating, it's like they're starving away. They became thinner and thinner and thinner until they finally passed away. And this is prior to the 1920s. So people that have no insulin, they can't make it. People without any insulin have what is called type 1 diabetes. There's different names. Type 1 diabetes. It's also called insulin dependent diabetes. You depend on insulin. You've got to inject the insulin to live. You have to depend on your injections. And this woman here is injecting her insulin in her stomach. Or it's sometimes also called juvenile diabetes. And the reason you call it juvenile is because usually we see this in kids. The kid walks in, he looks like an Auschwitz survivor. First thing you're thinking is what? That person has no insulin. They are a juvenile, young person, and they have juvenile diabetes, type 1 diabetes, insulin-dependent diabetes. They need injections to live. So how exactly does a doctor know that a patient cannot make insulin? He doesn't have any insulin, and that his patient has type 1 diabetes, no insulin. The undiagnosed type 1 diabetic patient who does not know he or she has no insulin is usually a young person who walks into the doctor's medical office and the poor patient looks just like a Nazi concentration camp survivor. This particular patient has no insulin and cannot make fat and basically is losing weight, continually losing weight, out of control. The patient is so thin, you can almost see through the patient's body in a strong light. The mom says that her child's been eating and eating and eating, but is still, unfortunately, terribly rapidly losing weight. The weight loss is out of control. The weight loss continues, no matter what, or how much food that this poor child eats. It is extremely important for you to understand. No insulin means no fat, which means weight loss out of control. Insulin is the hormone that causes the body to make fat. Without insulin, you cannot make fat. So it's a very important concept. We want to rivet this in. So I'm going to screech and yell this out loud because it is a biological fact. It is a scientific fact. There's so much proof you can't dispute it. If you cannot make insulin, you cannot make fat, no matter how much you eat. So you can eat and you can eat and you can eat. You just can't make any fat. The body will not take the food and make fat. It refuses to make fat because insulin is missing. And this proves the fact that your body can throw away calories, can throw away foods. It has the ability to do that. In this particular case, we're looking at the most extreme example. But if insulin can be controlled and lowered, it's going to do the same thing, isn't it? So we have to look for ways maybe that we could decrease our insulin so that we could lose this fat. So this weight loss happens because a patient who cannot make insulin cannot make fat, and fat is necessary for life. This patient is going to die. Since there's no fat for the body's energy needs, the body then eats itself up to get its energy. It cannibalizes it. A cannibal eats other human beings. This includes the body eating its own muscles. If untreated, a patient with no insulin wastes away and dies. Before Dr. Sir Frederick G. Banting discovered insulin, type 1 diabetes was a death sentence. So this child presented to Dr. Banting in 1923 with obvious symptoms of type 1 diabetes. She was wasting away. Clinically, you could see her skeleton. She was just a little flesh on top of a skeleton. Study the picture to the left, since it clearly shows that a child with no insulin cannot make fat. And this child wastes away, much like a Nazi concentration camp prisoner wastes away also. The picture to the right shows the same exact young girl after being given injections of insulin by Dr. Banting. Clearly, she looks much healthier, and her body has filled out by adding healthy fat after being given insulin. So you now know about insulin, and that if you don't have insulin, you can't make any fat. Well, guess what? If you got too much insulin, you're going to make too much fat, most likely assuming that you're eating. But what? What if you are significantly overweight now, you've got a big belly? Wouldn't it be wonderful if you could temporarily and reversibly, temporarily just for a short time, and reversibly you can go back to normal, and without any harm, no harm to you, shut your insulin production off just like a type 1 diabetic? What's going to happen? You're going to lose a lot of weight. So it should seem really obvious to you that if you could shut off or decrease significantly your insulin, you would then quickly lose weight so that you could eat what you want, get this, as much as you want, and still lose weight. Is that not crazy? It is a scientific possibility. We've looked at that. We've looked at insulin. We've looked at type 1 diabetes. We know that calories don't count at all with a type 1 diabetic. And then why? Because of insulin, right? So once we study insulin and what insulin does, we could possibly change things in order to control the amount of insulin that we have. We want to decrease it in order to lose weight. So I really hope that I've got your attention now, that maybe I've made a point, and maybe you're going to be thinking, well, maybe calories don't count in certain situations. And wait a minute, insulin rules. Insulin's a hormone. Let me learn more about insulin. It should be obvious that insulin rules. And learning about insulin and how to control your insulin is really, really important. So patients with type 1 diabetes have no insulin-making cells. And what are these cells called? They're called beta cells. And the beta cells are in their islets of Langerhans. Like islands are an area of water all the way around. Islets are little tiny areas. So there's little tiny areas inside the pancreas that are called islets of Langerhans. And inside those islets are beta cells, and they make insulin. So patients with type 1 diabetes have no insulin-making cells. The beta cells in their islets of Langerhans are permanently damaged and cannot be repaired. So if you look at the gentleman in the top left corner, you can see where that pancreas is, okay? It's right there, right at the top of your tummy below, above your belly button. So let's just think about insulin for a moment, right? If you have a big belly, you probably have too much insulin, right? Insulin's the opposite of severe weight loss, right? Having too much insulin is actually the reverse of type 1 diabetes situation. If you have too much insulin in your blood, your goal should be to slow down and reduce the insulin production in your body so that you'll lose weight. This is an important concept. No insulin, complete weight loss. Too much insulin, too much fat production, too much triglycerides spilling out into your blood, too much cholesterol spilling out into your blood. All of this high insulin causes all kind of severe problems, including atherosclerosis and polycystic ovarian disease, all kind of stuff that's nasty. Too much insulin's bad. So later, after you've lost all the weight you want, you can then turn on your healthy but sleeping islets of Langerhans. Those are the beta cells that make insulin back on like a light switch in your house. So these cells will then work normally once again. And sometimes even switching off it off completely for a period of time will allow these beta cells, the islets of Langerhans where insulin is made, to heal. So if you have diabetes and your body just can't regulate and control the insulin well, or you want to rejuvenate and make your isle of Langerhans beta cells happy again and all healthy. So it is possible to lose weight safely and rapidly, but you must first carefully learn about how insulin works in the body and how carbohydrates affect insulin manufacturing and release into the blood. It's all about insulin. So many people have calories wrong. They just don't understand. They think that 1 calorie is the same as another calorie, the same as another calorie. It's just crazy. A calorie is not always a calorie. We know that. You know that. And all calories are not always the same. Just take a quick moment and just think about this. Many scientific people have got it all screwed up. When you get a calorie of broccoli, or a calorie of broccoli is not the same as a calorie from a chocolate candy bar. A calorie of broccoli provides you with healthy, life-preserving nutrients, while a calorie from a chocolate candy bar is empty calories. So remember Dr. Banting's young lady that we looked at? Look at the left side, look at the right side. If you don't have insulin, you can't make fat. If you have type 1 diabetes, counting calories does not work because you're not you're just not going to gain any weight no matter how many calories are in the food that you eat. This situation where there's no insulin in the blood proves that a calorie is not always a calorie, that the body can do things that prevent it from making fat. And it's a hard thing to grasp onto, but if you keep on thinking about this little young, pretty little girl, you'll start thinking, well, wait a minute, can I get my body to do something different from what it normally does? Is there any way of controlling insulin? And if there's a way of controlling insulin, can I lose the weight that's been plaguing me? So again, if you control what you eat and eat the right things, not the wrong things, things that don't piss off your insulin and make too much of it, you can also create the same situation where you will lose weight despite eating as much as you want. Very important concept. And even though I'm telling it to you, you're going to probably, as you're doing your dietary changes, you're just going to say, this is not true, and you'll be watching those calories. And you won't be hungry even though you eat like a pig. So if you are controlling what you're eating, you're in almost no matter what you eat, you won't be hungry even though you eat like a pig. The calorie theory of addition and subtraction of calories doesn't always make sense. What happens to a type 1 diabetic when he or she overeats and does not gain weight proves that a calorie is not just a calorie. An untreated type 1 diabetic can eat 6,000 calories in a day and spend all day eating and never gain any weight. This is true. This blows this whole theory. It doesn't always make sense. It is not always true. And that's what I'm trying to beat into your head, because I know that, like, let's say if you start dieting and hit a plateau, you're going to be thinking a calorie, you'll reduce your calories. There'll just be a lot of things that you'll do wrong because you believe in this calorie theory. It's not true. So this particular video was created so that you would learn that a type 1 diabetic severe weight loss without any insulin proves that the calorie theory is not true. In this particular case, you put in 10,000 calories and you don't get 10,000 calories worth of fat because there's no insulin. You got it. There are various situations in the human body where the same thing happens. The body can choose not to accept the calories. The body can choose not to accept the foods. The body has a choice. And once you start learning about your body and what it can and cannot do and how to change your body's situation, you can control your diet so that you will become healthy. And this is what the whole purpose of this video is. We want patients to be healthy because basically having high insulin causes inflammation, causes increased cholesterol, increased triglycerides, increased blood pressure, right? It causes atherosclerosis, polycystic ovarian disease, early death, cancer, all kind of bad stuff. And for me, it's mostly the inflammation. I actually started working with patients because most of my patients had general inflammation everywhere, not just in the temporal mandibular joints. So I said, wait a minute, the body is made out of biological chemicals and there are certain biochemical reactions, and my degree was originally in biochemistry. And so I'm thinking, okay, let's make sense of all this. Let's make a lot of sense and let's look at it scientifically, because so often people will propose concepts to you and they're wrong. They're dead wrong. And that might be dead wrong to you. A lot of my patients go to sometimes 4, 6, 8, 10 other physicians, dentists, chiropractors, PTs, physical therapists, And they never get better because the things that they were proposing were wrong for that patient's body. But one of the things that I see in TMD patients is generalized inflammation. And it's through this hormone called insulin. And it also has to do with the increased weight gain because fat is toxic. I want to sincerely thank you for being my patient or listening to my information and attempting to help others as a professional. This particular video is on blood oxygen level test, on the blood oxygen level test. This is kind of an important, very important thing, which we very often don't associate with TMD, and it has to do with breathing and sleep and other issues. And just to review, the Atlanta TMD Institute has three purposes: to educate dental and medical professionals in TMD, to develop knowledge of TMD or temporomandibular disorders, which is really lacking, and to successfully treat patients suffering with TMD. And whatever your purpose is, this is absolutely a very, very important topic that involves several videos. And once you come to see the importance of breathing to the body, it just is overwhelming how many problems can occur when people don't breathe correctly. And this is particularly interested in dentistry right now because of obstructive sleep apnea. But there are many conditions where the inability to breathe is not as bad that you choke to death, but is really likewise causing major problems in a person's body. This video is presented by the Atlanta TMD Institute. The purpose of the Institute is to educate dental and medical professionals in TMD. Prior to COVID, we were lecturing a good bit. We're going to try to continue that as things get better and better. We want to develop knowledge of temporomandibular disorders in general with books, and also to successfully treat patients suffering with TMD. And we're a tertiary center, meaning that patients can come directly. Patients can be referred by physicians, dentists, physical therapists, and also by other specialists. If there are major problems, we are here to think things out and analyze and be successful. The title of this lecture is The Calorie Lie, and we're getting involved in diet because diet has a great deal to do with TMD, and excessive fat also has a great deal to do with TMD and sleep disorders. So we're going to bite right into the calorie lie and try to get you, first of all, to learn things in a new way, think completely differently. And it's going to be difficult because we're going to give you information in the video. You're going to listen to it. It's going to make a lot of sense. But I think 2-3 days later, even, it's going to be hard to break out of your old thoughts, things that you were taught. And because this is totally revolutionary, it's not revolutionary from the point of view of, my God, the information was not there previously. It was there. It's just people didn't put it together. So we're putting things together for you so that you can think about decreasing your inflammation and your weight and the toxic fat load that so many TMD patients have. So thank you so much for looking at the video and thinking about some of the concepts. Undoubtedly, it's going to take a little while for this information to sink in and become real to you because it's so radically different from what you've been told in the past. Um, the Atlanta TMD Institute is devoted to doing everything it possibly can to help TMD patients. We are not simply a tooth mechanic where we put dental appliances in people's mouths and think that everything's going to change. No, TMD is a complicated condition and it involves multiple areas of the human body. it crosses over multiple specialties, right? Like ENT, neurology, right? You've got physical therapy problems, you got chiropractic, all various things that all interact, allergy, that go in to create a sick patient. And I don't like thinking simple. Thinking simple is like, oh, I can make a appliance, a dental appliance that goes in your mouth and get you better. No, that's just, yeah, you can improve a little bit. And that's how most dentists think because they don't understand the full disorder. And it is a disorder, not a syndrome, meaning that different patients come in with TMD with different presenting symptoms. So it gets really confusing to diagnose. But we're dedicated to being sure that we get you healthy and throughout life so that you are doing well and that you thrive and hopefully live long and prosper. Thanks.